Welcome back. I'm really pleased to introduce, last but not least, our session about benefits and risk of artificial intelligence for health and well-being in the workplace. The need and the idea to promote such a session departed from the participation of ECH Alliance in one of our major research innovation actions, which is smartwork, a project developing innovative solutions to sustain workability in the office setting, something actually very actual now in the COVID pandemic. However, of course, many topics need to be tackled when we speak about AI. Some of those were touched upon also yesterday in our first day. So I will leave the floor to my colleague, Carolina Mikiewicz, Senior International Project Manager at ECH Alliance, that, departing from some introductory thoughts, will engage with some experts in the field about the implication that the use of artificial intelligence has on health and well-being of citizens. Thank you so much for attending our last session. Please don't forget to post your question in the chat, and I leave the floor to Carolina.
Thank you very much, Valentina, for this introduction. Hello, everyone. Good afternoon. I'm pleased to meet you all online today. Yes, we have an exciting panel, 60 minutes panel on the topic that is one of the most discussed currently, AI benefits and risk. And I have 5 distinguished expert professionals from different fields, from different professional backgrounds joining me today. And I would like them to introduce themselves to you, to tell you a bit like what brings them to this session. We have with us Cornelia Kuterer, who is the Senior Director and is leading the team of the Rule of Law and Responsible Tech at Microsoft. Can you shortly tell us, Cornelia, what brings you to this session?
Thank you very much, Carolina, and thank you for inviting me to this panel. It is a very broad topic, and I'm very much looking forward to the discussions. So I guess what brings me here, I am responsible for European policies around rule of law and responsible tech, privacy, lawful access, digital safety, human rights, and responsible AI in particular. Fostering conversation in how AI can positively impact society. But I also do support our health business specifically on these topics. And I think that's where all these questions that we hopefully address are my daily bread, so to say.
Fantastic. Welcome to this panel. And next we have Haris Vassiliou, Digital Strategy and Business Development Consultant at Byte Computer, joining us from Athens.
Good morning from me as well. It's an honor and a pleasure to be among you today for this really exciting panel. Thank you, Valentina and Carolina, for the introduction. As Valentina mentioned earlier, what brings me to this panel is the fact that I am the project coordinator for the initiator of this idea behind the panel from the project SmartWorks that is dealing with exactly this topic, AI in the workplace, increasing well-being, and all the elements and aspects related to this approach. Quite recently, there is also a more direct interest for me personally, being assigned as an advisor at the Ministry of Digital Governance here in Greece, looking over elements of digital transformation, in particular in the area of health. So many of the ideas that I'm looking forward to discuss with you today could also be very interesting for being applied in the Greek healthcare system. So thank you again for inviting me.
Thank you. And next we have Isabel de Zeger, who is the founder of Biloba. that is focusing on health data sharing solutions. Welcome, Isabel.
Thank you, Caroline, and thank you as well for inviting me. I am also the lead of a group called My Data for Pandemics within the My Data organization, really making sure that what we do around COVID is in respect of human rights. And one of the reasons which is quite important, which is important for me in this presentation, in this panel, is the fact that, as we'll discuss, most potentially, we need data. We need a lot of data, and we need to make sure that those data do respect human rights and data privacy. And that's definitely a point I hope we are going to develop, because AI is as good as the data. And so very interested to be here and to discuss the topic with other very experienced people. Thank you,
Thank you. And now we are going back to Greece with Iraklis Varlamis, Associated Professor at the Department of Informatics and Telematics at the Herokapia University of Athens, also representing the SUSTAGE project.
Yeah. Okay. So thank you, Carolina, for the invitation and for spelling all these difficult Greek words correctly. So yes, as you said, I'm invited here in terms of the SUSTAGE project, which is a project that is led by the 4th Research Institute in Greece. And the SUSTAGE project actually is a project about workers and the well-being and sustainability of elderly workers in the workplace. So my, let's say, relation to this is that I'm actually researching on the domain of recommender systems. So it's a part of AI, let's say, discipline. And the idea in SUSTAGE is to be able to provide recommendations to workers that can help them to improve their well-being, their safety, and all other aspects in the workplace. So this is how I relate to this talk, and it's a pleasure for me to be with you in this panel.
Thank you for this introduction. And last but not least, Giulio Iacucci, joining us from Helsinki, professor at the University of Helsinki, Department of Computer Science, and also representing the CoAdapt project.
Thank you, Carolina. So hi, everybody. So I'm Italian, but as you can see from the background, I'm in the north. Actually, this nice aurora in the background could be the AI looming above us. So I'm also affiliated to the Finnish Center of AI, and my research is in intelligent user interfaces. And we've been over the years trying to innovate new applications in collaborative work, and lately a lot of effort into health. And yes, in the project, in the current European project I coordinate, we try to look at collaborative robots, but also to try to, again, have people provide them personalized task support while they're working. But in many of the projects we're looking at, for example, on COVID, AI is seen really as an enabler to, for example, helping change behavior. That without changing the behavior of people, many of the things which we try to do in COVID are kind of not effective enough. But I look forward very much to the discussion now.
Thank you so much. Great panel. I'm very happy that we can be here today. So let me start maybe from giving a bit of introduction. Valentina already mentioned like why we are here, why the European Connected Health Alliance smartwork project together with the other projects and also other experts actually called this session. Now the audience also knows our panelists better. I encourage you during the whole course of this panel to use the chat option that is like on the right from your screen to share your question, also comments, discuss with your colleagues. And I will give a bit of introduction to the to this panel, to the discussion, and then I will ask our panelists to comment on this, to share their experience and their view from their professional standpoint. As I mentioned already in the opening words, the topic of AI is one of the currently most discussed, especially in the area of health and well-being. And of course, also there is lots of reports, lots of documents being published. And I looked into two. One is on the artificial intelligence, occupational safety and health, and the future of work that was prepared for the European Agency for Safety and Health at Work. And while the document is very, very broad and it goes very deeply into the analysis of the risks and benefits of using AI, is also it warns us about many of the potential risks and challenges in the implementation of AI in workplace. But it also says that people would actually prefer in the workplace the AI in the workplace as an on-demand helper rather than a manager, coworker, or proactive assistant, because having the AI replacing a physical boss could actually cause lots of stress. But at the same time, AI could improve safety, help reduce mistakes, and limit routine work. When it comes to the report recently published by Deloitte and MedTech Europe that looked into the socioeconomic impact of AI in healthcare, I'm sure that we all know some of those numbers that are rather encouraging, saying that while we could save hundreds of lives in Europe annually and save a billion of years if we only implemented correctly AI in health. And as we already said in the introduction of the panelists, already 3 projects were mentioned: smartwork, Sustage, and Co-Adapt. There are, of course, plenty of different initiatives, plenty of different research and development projects. We at smartwork, we at the European Connected Health Alliance, cooperate currently with 6 other projects that are working on AI solution that would support health and well-being of older workers in the workplace, looking at this issue from different disciplines, different industries. Smartwork itself looks at the supporting the office workers, and we are developing the suite of 6 different services. And as the result of this cooperation, a report, a non-scientific paper was published in September. We looked together with the other projects into the role of AI technologies in working through COVID-19 and its aftermath. Well, of course, we concluded that, yes, the COVID definitely disturbed and changed the way we live, work, and spend our time. There are the effects on the physical and mental health, and AI can play a great role in providing solutions, providing the support for the workers, if they work remotely from home as the office workers, but also when they work in the factory, in a place full of people. And AI can provide solutions during the emergency, but also in the long term. But of course, there are also plenty of risks and challenges. We know that one of the biggest risks is increase of the surveillance, increase of inappropriate monitoring and tracking. Also, we did the user questionnaire in smartwork, and we learned that yes, the employee resistance can be one of the challenge for introducing the AI or really benefiting from AI, and also the complexity of existing IT infrastructure. Lack of the integration of the solution creates the risk for fragmented implementation. So I would invite now with this very brief introduction, very brief summary of some of the current discussions on the benefits and risks. I would like to invite our speakers, our panelists, to actually look at those comment from their professional experience, from their professional standpoint, how they see this. Are those benefits and risks currently correctly identified? Is there still something big that we are missing, and how we actually can overcome them, that we implement the, I think I stopped sharing my screen at this moment. And then I would like to also introduce, invite everyone to share their call to action with the policymakers from national level, but also European level. Perhaps I will ask, well, Cornelia, let's start from the big player in the field, from the Microsoft, and you also work with the policy regulations. What's your view on those risks and benefits, and what would be your call to action?
Thanks, Caroline. It's always hard to start, but let me try. So yes, I think it's a really good discussion, just also in view of the forthcoming European Commission proposal to regulate AI, and the Commission has already outlined in their white paper the broad range of benefits, but also the concurring risks in using AI without proper safeguards. I think there is probably no better area to discuss this as with health data, which is per se sensitive data, and in the context of workplace where you have very delicate relations to the employer relations. So I think in combination, you get probably a lot of huge benefits, but also very sensitive discussions around how to safeguard against abuses. I will spare you with my introductory remark in how the pandemic has showed how the use of digital tools and in particular AI has greatly advanced the work of first responders through these type of technologies. Let me eventually focus on what we currently do in addressing risks in the context of our efforts. So Microsoft has developed a major undertaking in really trying to operationalize our ethical principles that we have set forth in 2018. They align fairly well with the high-level group on AI principles, but also other principles such as developed by the OECD and other international fora. Our focus over the last 2 years has really been in how to develop these. And a point that I will try to summarize here is these are steps. It's a huge opportunity in looking at an AI application. It doesn't really matter which one we are talking about now, because there are so many different examples in this space. But taking an example and then really envision the opportunities with this AI application, but also really holistically think through who is impacted and how. And by doing this at the very early stages of the development phase, then develop mitigation strategies in order to benefit from the opportunities, but mitigate the risks that might apply is really important. And how you do this in the development phase is really through tools, either technology or practices such as data documentation, to build an accountability system that will help to operationalize these systems. Now, there are areas in particular then in the implementation or the deployment of the AI that you also have to think through these issues. So we try to support our customers as well that deploy these technologies in how to implement these strategies. In that context, we think about sensitive uses. We think about risks to fundamental rights, to safety and health harms, but also to potential AI systems that might have an impact on consequential denial of services. If you think about, for example, healthcare provisioning, these are the categories of potential deployment of services that we provide, that we go through an exercise in really finding solutions, even contractually with our customers to mitigate these or deny the service altogether. All of that said, that's an internal standard that we are currently deploying with our engineering groups and sales organizations, but often that might not be enough. So there are areas that we believe require also regulation in these spaces. And of course, at the end of the day, the challenge for regulator is how to approach regulation where scenarios are in a way endless and so diverse, and each might require specific mitigation strategies. So that's the challenge that I'm not envying legislators to get the answer on that. But I think that's sort of the first approach that we think through in this. And the call here is really incentivize the industry to really think through responsible AI governance and regulate where high risks occur.
Thank you so much, Cornelia, for this introduction, for those comments. Of course, regulation, that we can discuss also what should be regulated, how it should be regulated, what are the suggestions and the recommendations for the regulation. So this could be one of the big topic, but yeah, and you already mentioned that there are so many different scenarios. Scenarios are endless. Thank you for that. I will call now for the other panelists. Maybe, well, Haris.
Yeah.
Apologies. Thank you.
Yeah. Thanks, Carolina. It's really important to start discussing such a huge topic, and actually it has so many elements that it's really difficult to fit them in one very fruitful discussion here. So I think we are only scratching off the tip of the iceberg. I think we have a very important element in terms of the risks, as also slightly been introduced by Isabella earlier. The fact about the data. Well, I think this is one of the major issues that we should be considering our efforts, the data-related risks in principle. Because let's not forget that mainly AI is about data. I mean, this is the core element. So all the other aspects about regulations and so forth, or technology is basically utilizing the data. So if you look at regulations, it's how you use the data. I mean, legally, let's say, if you see technology is the element of what does data mean, and how you can use them in terms of an AI application and so forth. So we have different aspects such as the fragmented data landscape, where data are located right now in different silos, and you don't really have a very easy access to this data. You have elements related to the data quality, how accurate this data is, or how useful this data is for potential AI applications. You have elements regarding obviously the data privacy and protection, and last but not least, issues about cybersecurity, for instance, that's increasing attacks in healthcare systems, in IT healthcare systems nowadays. You look at examples also recently portrayed about, cyber attacks on COVID-19 vaccine attempts and so on. So this is an important aspect about data, and the element is how to look into a more European, if not global, strategy behind the utilization of this data in those aspects. So there is, currently one really important project going on in the European health data space, which is trying to cover some of these elements. And there's a very critical attempt there from the European Commission, which aims to produce some results by the end of 2025. But we should look definitely in how to adapt those principles and have a common baseline in all European countries. In Greece, nowadays we are looking in defining a national strategy for AI in particular, in order to have an approach which is equivalent for all applications that are developed at the governance level, including applications for the healthcare system. So we should be looking, I believe, on these issues produced by the European health data space, not only in terms of customizing it at the country level, but also looking at the potential customizations for different domains, such as the workforce domain that we are looking into. Some of the elements you mentioned in the beginning are quite critical. We've seen them in smartworks. So how data can be related, so data quality elements in terms of the workspace, or how data fragmentation can be overcome for companies, or interoperability. Some data are quite sensitive. Different companies obviously don't want to share data. So these are definitely critical aspects we should be looking for. And obviously other risks that are related are legal and regulatory risk, which is a big chapter. As you said, we can discuss about it later on. Potential organization and financial risks, as well as social risks, such as elements about workforce trusting these applications, or improving working environment. But for me, at the end of the day, it comes down to the data. It comes down to the education of the people that are related or associated with these applications, from governance level to employers, and then consecutively employees, and so forth. So I think these are really critical aspects which you look into and take existing practices and trying to customize those.
Thank you so much. So yeah, trust data education. We had yesterday also a session on the citizen-centered data sharing governance. Again, trust education, digital literacy, health literacy. Maybe I will then thank you for this comment. Maybe I will look then for the voice from academia, and here Giulio. How would you? What is your take on that?
Yes, thank you, Cornelia and Harris, for very important comments. And I completely agree with the point on data, as AI is little without data, at least most of it currently. And I'd like to take a step back and just reflect and help the audience think what are possible objectives we might have in introducing AI in the workplace? Just to take one step back and simplify a bit the narrative. And I've been thinking about this, and I see at least 3 aims. I'm sure there are many others, but one important point that has also being brought together by the Institute for Occupational Health here in Finland is the concept of workability and productivity. I don't say only productivity because I find that it's sometimes a bit reductive. For example, productivity for me possibly means also equality if you think of workability. And that's why many of us in this panel are working with aging, so that the AI could be an instrument where we actually help some of the workers in utilizing, for example, this is in the case of aging worker, utilizing all their experience, but still being equally possible to contribute, even especially in the area of ICT, where aging workers maybe are sometimes left a bit behind in the use of the tools. And so just productivity, workability, one big aim. Then, of course, health is another big aim, which is tied to not only supporting your main task and personalizing the tools you have, and so increasing your workability, but health, I think to be productive, health and productivity go hand in hand, as you can see in many of the studies that shows how absence work days due to, for example, mental health disorders are actually affecting the productivity very much. So I think health and productivity go hand in hand, and AI can do a lot for health. I was mentioning change behavior, and then of course you have safety. These three pillars, I would say, are very important to me to see them not just as separate things to address, but we need to understand the interconnections between these three things. And then I don't want to talk too long, but why AI is especially good. Then I'll come to the risk and the problems in a moment, but why is especially good, I think, is that it helps in scaling intervention. So whatever new service or functionality you might think in helping in these three pillars, I think the AI is a wonderful tool to actually scale whatever you're trying to do and provide these functionalities and this support with a consistent quality, with the personalization needed. And this and now I'll because I don't want to talk too long, I'll come now to what I see more the negative side, and possibly maybe just a couple of words how to address them. Is the risks, of course, we know about the privacy problems, and it's not new because we are all using Amazon, Google, and all the other services, and our data is used for many things we never know for what, and there are risks of exploitative bias, so the fact that there might be uses of our data that we don't agree with. And this is a big problem. I think I would say some of the biggest. Of course, complexity is also a big problem. But now to just finally conclude how I think we could address some of this risk is one big problem quite well represented by the My Data movement is that we should help people be more in control of their data. Currently, you need to read the very many pages of fine prints to understand what the heck will happen to your data. And this is not acceptable. This is completely not acceptable. And we need the new approach that puts the people in the center stage in deciding what benefits do I get by releasing my data, but in an understandable way. Now, currently, it's completely ununderstandable. And finally, just two words. Explainability and accountability. How to address those? We need to take these things seriously. People need to be able to understand what is the system doing. And I mean, I'm saying quite obvious things, but I think it's good to. I wanted to make a small summary of what are the bigger themes, also for my own understanding. So thank you very much for the opportunity.
Thank you for giving us the full overview also, and looking deeper into the benefits, and bringing this issue of the, again, human-centric approach, bringing the person into the center. I actually will want to later with all of you to discuss about this. You call it exploitative bias, and also the relation between employer and employee when it comes to the AI. But just to also hear from Iraklis and Isabel, what are your initial comments on that? So maybe staying within academia, I don't say that you have to have the same view, but staying within academia, Iraklis, if you can shortly share your comments with us.
Yeah, okay. So I would like to to agree with what Harris and Julio said before. I will stick mostly on the risks, and also on one of the risks that you mentioned also in your presentation, Carolina, about data sharing and privacy. So the fact here is to understand with who we share our data and for what purpose, for what objective. So if this works somehow, if we are happy with sharing our data with someone for a specific objective, and if we know it in advance, and this is where regulation can also help us, then it is possible that users will will take, let's say, the risk to use AI, and will be happy of having the benefits of this use. So this is what people have to clarify. For what reason workers would share their personal data, for example, who will use their personal data, and for what purpose, for what objective? Because at the end of the day, workers would be happy to receive, let's say, safety recommendations, or to receive well-being suggestions, and to receive, let's say, any recommendations that will help them improve their physical or mental abilities, for example. But the main, let's say, concern, their main concern is who they are sharing their data with, and if the data will have different uses. So I would raise here the issue of trusting the application and the use of data that this application is performing. So this is what is still a challenge for people that are developing such application to cultivate, let's say, a sense of trust with the end users. And from what we have seen so far with recommendation systems, for example, in my research, is that we can build trust with the users if we explain how the results are achieved. So we need explainable AI, as Julia said. If we allow users to visualize their data, to have a manipulation on their data, if they can play with their data, the data that they share, so they understand what they share, because for the moment we just monitor users, but users do not know what they share. And the final, let's say, point there is we need to allow users to validate where the recommendations or where the output of the application, the use of the application is appropriate to their, let's say, to their needs. So we need validation, user validation of AI. So this is more or less what I see for the risk of sharing, data sharing, and trust on the data. And of course, the benefits can be many for workers. For example, they can profit, as Julia said, safety. They can have personalized solutions that match their needs, for example. And let's say a point from Sustage is that we try to maintain this privacy, let's say, with a privacy preserving framework that sends different recommendations to each individual workers, and different recommendations that refer to a group of workers and not to individual workers, to the shift managers, for example. So we separate the types of recommendations that or the type of information that we share with different groups, in trying to anonymize, let's say, somehow information that we collect from the workers.
Thank you for sharing this perspective with us. And of course, one of the central points here was trust, making sure that the workers actually want to be part of this experiment, this exercise. Isabel, you are coming from also My Data community, where the trust is one of the key issues. What is your take on all this discussion around AI and how to actually ensure this trust, which is such an abstract concept?
Well, that's exactly, we need to make it real. But maybe before we go into trust, which is absolutely indeed central, I really would like to step back, because when we have a conference about AI, talks about AI, I'm always a bit nervous, because we put everything in a big bag, while AI is many different things. And I think we can consider fundamentally three technology. The first one is expert system that we would typically use as well for decision support. The difficulty there is nothing to do with data, it has to do with eliciting the right knowledge rules. The second type of technology, it's machine learning, which is what we are all using and talking about today here. But that's based on data, a lot of data, but anonymized data, which is a different problem from a GDPR perspective. It may have ethical issue, it does not have a GDPR problem. And the third type of technology, it's more intelligent agents like chatbot, typebot, which are much more based on personal data. They are using those ones to be adaptive, and then they are using a lot of different technology. And then the challenge is also then to include individual data. So I think it's important when we speak about AI to be clear that there are three different things, and in most of the time, they are important together. Now, quickly about the risk, because we've been speaking a lot about the risk, and let me come with some concrete example of those risks. We spoke about, and being a physician, I've been in computer science, and I've been in AI for 30 years, so I have a little bit of a kind of a history there about risk. So machine learning is as good as the data. There is a famous example in a US court that basically where they had a machine learning algorithm that was predicting what the sentence should be. And that system predicted that there would be the same risk of reoffending for an 18-year-old black girl who committed a very small petty theft for the very first time. And she was assessed as being at the same risk of reoffending that a 40-year-old white male who's been convicted many times. So the machine learning system would be completely wrong. That does not give you any trust in such system, right? Another big risk, and I've been personally involved in those one, is that machine learning is very much related to wearable. And you mentioned that, Caroline. In one clinical trial we've been working, 60% of the wearable did not work. Before we realized that, our machine learning algorithm had already come with predictions which were not correct. So extremely important to make sure that we can trust, again, the data collection instrument that I use when you actually apply those machine learning. On data privacy, I was just reading last week, PwC installed or is requesting for all the employees that are coming to work to have a little watch which can detect where they are at any point in time, with whom they've been talking to, because if you sit more than 2 minutes with somebody, so that starts really to be an infringement of data privacy. At the same time, and you can stay home. So what is kind of the balance between the two? So I think it's, again, they are using that, we don't know exactly what for, but there's definitely a concern about that. And other people mentioned a lot about the fact that it's difficult to get all those data. Absolutely correct. 99% of the data we have are stored and not used. And people like data scientists spend 2/3 of their time to clean the data before they can actually use it for machine learning. So it is really a big problem. And if you look at those different components, that's where I think you mentioned, Corey, that it's important to have regulation. And as a matter of fact, in pharma and clinical trial, machine learning are considered as a device that they need to be tested, trial validated to make sure that they do what they are supposed to do. Critical if you want to ensure trust. make sure that whatever your tool is supposed to do is doing it. No, in terms of call of action, yes, Julio, thank you for mentioning my data. I think we need more of those type of activity where we come with the technology that allow the user to actually manage their own personal data. We don't have enough of those one. We need more, and they need to be governed properly. And related to that, I think what the EU is doing around the EU data strategy, around all the work they are doing around governance is extremely important. Where I would like to have more clarity is in the EU data space. I have no idea exactly what we are talking about that. Do we speak about anonymized data, which would be EU protectionism for me? And what our American colleagues are telling us in my data, they don't like that whole concept. Or is that really something where we speak about individual personal data, which is going to enhance EU citizen? And quickly, the other aspect, I think everything which is happening in Europe around fair and go fair and verification of data and data standard is extremely important because that's, again, allow reusability of the data. So thank you.
Perfect. And thank you so much also to remind us about all the different problems or the issues that the developers of all those technologies should be aware of. Of course, we know about the gender bias, we know about the racial bias. So this all relates to the quality, availability of the data. And all of you, I took a note, ethical, like when it comes to the call to action, we had ethical principles while securing the quality access to data, a human-centric approach to data, so people secure control over the data, cybersecurity, accountability, and in introducing the mechanisms to actually secure the trust. But I'm just also thinking about the possible risk or a challenge of the employee-employer relations. So in the situation where, of course, we believe that AI is great, AI can be a helper, AI can be an assistant, we save so many lives, so many money, and we improve the people productivity, which is the word that I don't necessarily like also Julio mentioned. How do we actually ensure that the person is that still we protect the workers' rights? Or actually that we even do we have those rights written somewhere? Is this do we have is our legislation in European Union actually following the developments in AI? Do any of you want to comment on this worker employee employer relation here? How to ensure that it will be balanced?
I can eventually chime in if you want, Carolina.
Come in, yes, please.
Okay. Well, I think from a helicopter perspective, in Europe, both the Human Rights Convention and the Fundamental Rights Charter actually help structure the conversation in a very good way, I believe. So we have in the Fundamental Rights Charter, we have non-discrimination, we have dignity, which of course applies to the dignity of workers in particular. Around these themes, I think we can build from, there is a positive obligation of states and governments to ensure through secondary law that these rights are also ensured in practice. So, and this is sort of where the debate currently is, what needs to be done, are there gaps to ensure that, and often I think there's a lot to learn currently as we deploy these AI technologies. You mentioned I mentioned at the beginning, you mentioned the risk around surveillance, and I mentioned this special relation of employment. But around those fundamental rights, I think some of these issues can be addressed, and there are existing laws that protect workers. We will have to, I think, understand better how these laws will be applicable in the context of AI. My call would always be that when when technologies are deployed, there needs to be multi-stakeholder conversation, what's the intent, and write this intent down and build mechanisms to review in order to see how it develops, and just have circling back loops to improve the technology. A core issue here that I think is important is to use and deploy, to develop and deploy the technologies so that they are indeed human-centric, requires a real culture shift in how we approach this. And the one word I haven't heard yet in this debate is inclusion and diversity, because many of the risks that we are thinking of in terms of like discrimination, for example, I think they can also be avoided by having diverse teams thinking about the issues. So that it's a very multi-dimensional approach that is required to get it right.
Thank you so much for this. And also, well, that's very important actually, issue of diversity, inclusivity, equality. We also know from general lessons from public health that usually those who with the lower health literacy, with the lower digital literacy, with the lower socioeconomic background are those most vulnerable, and at the same time then we implement the different technologies that are also should support them in the work and be this assistant and the helper. So again, also how to improve the balance from this perspective. And we heard earlier from, I think it was from Julio, that also the technologies, the AI technologies and solution can actually help scaling up some positive developments. Currently, of course, we have so many different fragmented solutions being deployed. Do you have any of you any like suggestion how to actually make sure that on the EU level we are able to scale this movement in a positive way? And also any of you? Someone has the microphone open? Isabel?
Yeah, I think it was me, Carolina, but maybe because and if you don't mind, first, Cornelia, I completely agree. If information to people, transparency is critical, and the possibility to opt out, which is absolutely critical. At some point in time, people need to be able to say, no, we need to stop this and not be punished by that. But there is another thing which was also in the chat, Caro, which I think is an extremely important point. It's not so much the relationship between the worker and the employee, which is very, very important, but it's also the bigger macro level. It has been shown, and that's only for AI, that AI is decreasing the number of jobs that are being created against the one which are lost. Because typically when you have a new technology, you lose job and you create more. So it's good for the economy. It has been shown, it's a book with all the big guys about AI in the world that have been interviewed, and it concurs that AI is creating less jobs than it is actually killing jobs, which means that we are going to get into a situation where we are going to have less jobs that we used to have before. And then they go on with all that discussion about, what can we do about that? Yes, we can revalorize certain jobs, but still, the whole idea then is to have a minimum basic incomes for everybody across the globe. But that by itself has a huge economical impact. And why should you have some money if you do nothing? And that, I think it's another topic related to work, which is not for the people at work, but it's for the fact that people will potentially have less work to do. Certainly everything which can be automated by robot, which we did not speak about it. But we have to take that into account, that the world of tomorrow, it's going to be with potentially less job. And so what are we going to do with the people who do not have a job anymore? And I think that's a really tough question.
Thank you so much. Another important issue, and now with we got the permission to prolong the session by 5 minutes. So now with for the closing words, maybe like we've heard a lot about the side of the risk, on the side of the benefits. You all are, and also your recommended actions that you would like to see. Maybe to get one closing word from all of you on where, if you had to choose this one particular action where you would like to commit the resources for making sure that implementation and use of AI for health and well-being at workplace will be better. What would be this one particular action you would focus? Maybe I will start from Iraklis. What would be?
I'm mostly a data person, so a data mining person. So I would stick with the data quality part. It's mostly a technological, let's say there are many technological solutions in this part, for example, using redundancy of sources, multiple sensors and data fusion in order to improve the quality of data that we collect, in order to build, let's say, more data supported, better data supported solutions for the workers. So my effort will be on that side.
Super, thank you. Yeah, just jump in.
Yeah, I can go next. I find this concept of explainability important, sometimes boring, but definitely challenging in the sense that it's difficult to be efficient also in trying to explain the essential working of what is going on inside the AI. And we actually, as a department, I don't know if you're aware, we have at the University of Helsinki, we have the biggest online course on AI in the world. We have won several awards around the world for it. And for us, this is Teemu Roos, our professor who done this. I admire him very much, and I encourage you all to go and take the course. But that's really important, but difficult, and at times also not the most exciting things, because I like to build the things, most of all, not just explain them, but definitely that's an important part, I think.
Super.
Yeah, if I can just quickly add, follow up to what Iraklis said, I am actually torn a little bit between the data elements, and I would go for data interoperability primarily, not only quality as it was mentioned. But then again, I think that also digital AI literacy is also something that is applied in many levels, and it should be something to look after in the future.
Caro, I would not be a my data fan if I would not put the individual at the center. And for me, what is important here is to make sure that the individual have enough literacy of data and AI, I think to your point, Caris, that we make sure that we earn trust, and trust needs to be earned by those people and by any individual, and that we provide enough incentive to the individual that they actually want to actually use this technology. That makes sense for them. There is benefit for them. Super.
And Cornelia, we opened the whole discussion with you. What would be the action for that you would focus on?
And I would probably also end where I started. I think companies that develop and deploy, companies or governments that deploy AI should make sure they have a governance model in place that can actually address these risks by being transparent, engaged with the stakeholders, all stakeholders that might be impacted by the use, in order to build that trust that Isabel has put forward.
Thank you so much. It's been a pleasure to discuss this issue with you. I hope that we can continue working together or making AI better, more functional, more human friendly. It's of course a massive issue, but it's heartwarming to know that there are so many great experts around Europe, around the world, who are very mindful of all the risks and also eager to work on this. So thank you all for joining me today, and for the audience, as Giulio said, yes, there is the free online course developed by the University of Helsinki. I will try to jump in on the chat and post the link there if it's no one has done this before. I think it's called Principles of AI, and Finnish presidency in the EU, that was last year, they promised to translate this in all the EU languages. So I started the course. I haven't finished it, but it's but it's a great adventure for all of us to increase our digital literacy. So I wish you a beautiful day. I wish you a nice, healthy afternoon. Thank you so much. Goodbye.
Thank you so much.
Goodbye. Thank you very much.
Thank you very much, Carolina, for this exciting conversation, and thank you to all the speakers to be so proactive and engaging. Thank you so much. I will just now pass to a very short wrap-up and say a few words, because we have come to the end of our Digital Health Society Summit 2020. Yesterday, we had very important discussions around the health data use and sharing, and we learned a lot about the results of multiple open and collaborative multi-stakeholders consultations and reflections that have been run by the Digital Health Society together, for instance, with the IHT, All Policies for Healthy Europe, just to name a few of the many health data initiatives that are running right now. All these reflections translate to recommendations that we do hope will help European institutions and governments to undertake the most effective and suitable policies for the big challenge they have ahead of them, to increase resilience, preparedness and sustainability of our health systems. And we also had the opportunity to listen to the trio presidencies and understand what concrete directions these three countries are taking and how they are, with their work, they are leading the way under the presidency's umbrella towards greater harmonizations and coordinations across the European Union. Furthermore, we had also the chance to listen regarding some successful good practices and important steps forward undertaken in some of the ECH Alliance regional ecosystems in Germany. And this reminded us about some very important concepts like regional multi-stakeholder collaboration, the importance to connect dots and engaging in public-private partnership, and also linking our job at regional level with the smart specialization strategies in each territory. The importance of having an ecosystem approach that, of course, you know, is central in all our work at the CH Alliance, I think leads us naturally into our second day, during which we decided to dedicate the first half of the morning to the opportunities that in terms of economic growth and job creation, the overall health sector innovation can bring to our economic systems, and especially to SMEs and startups, which we know represents a large part of our economy. And in spite of all the progresses made so far, are still in need of support to cope, to be able to cope with the many challenges they face in the different phases of the journey to become sustainable. Lastly, we went further in the discussion about artificial intelligence, specifically artificial intelligence and its use in the workplace. Artificial intelligence, of course, was already a hot topic in our agenda on the first day. And today we listened and discussed about current limitations such as data quality and fragmentation, and also interesting insights about the future-proof legal and regulatory frameworks that we need to put in place. Overall, concluding that the use of some technologies, such as AI, can have, of course, major benefits for all of us, but also implications in terms of human rights and privacy, for instance. So those implications needs to stay at the top of the political priorities in the next months and years. I really can say now that we have come to the end of this summit. On behalf of the DHS and the ECH Alliance team, I would really like to thank again our sponsors, delegates and panelists, and reiterate our willingness to keep working together on all these important topics. I also wanted to remind you that all the sessions have been recorded and you will find them available online very shortly. And of course, don't miss our networking session after enjoying a proper healthy lunch. Thank you so much for joining us. It has been a pleasure, and we do hope to see you soon again in other fruitful virtual or hopefully physical events like this. Thank you again. Bye. Are you well?